We would now love to see if we can answer some of the questions that you might have of us. The easy ones come to me and the difficult ones go to them, but I will serve as the individual who's triaging up here, if that's okay.
Mr. Katz, what
Yes.
does this mean for the regular person who either uses OSF or, say, Rockford Memorial Hospital? What does that mean for them in the coming months?
I think in the coming months, probably very little change. Both organizations will operate as they have. I think the excitement is down the road in terms of what can be offered. And with the two organizations coming together, if that happens, we will be able to have a large physician group. It'll be easier for us to attract physicians, especially those in subspecialty areas. Obviously, going forward, whether it's Medicare or Medicaid or commercial insurers, I'm not sure that hefty price increases are in the picture. If you look actually at the impact of national health reform, payment might be actually dropping, if not stabilizing. And so I think we're looking at the ability to get a different handle on our cost structure, and overall, hopefully, all those things combined will increase accessibility for residents not only in Rockford but also in the greater region. We think this would be a significant regional institution providing significant benefit for those throughout the region.
You may have already mentioned this, but when did talks about this begin to take shape?
Well, to get to this point in time, this letter of intent, we've been talking probably for what, 8 months? 10? Time flies. But I think this was something that I've been here 15 years. After I'd been here 2 weeks, I could see that there was probably a better model for healthcare organization in this region. So certainly last summer, Gary and I have a regular interaction discussing issues of Rockford, some potential ways we might be able to work together. And this was something that we started talking about last year, and it's brought us to this point.
Who initiated the proposal for the merger? Was it OSF? Was it Rockford Health System? Did one approach the other first?
Who paid for dinner?
I can't remember.
Well, I don't remember exactly, but I know Gary and I were bouncing ideas around, and this was one of them that came up. So,
how do you match the two cultures? You've got a religious-based institution and one that's not. What are some of the challenges that you potentially could face in trying to assimilate both of those?
well, I mean, they both start from the same place, though. It's about serving people. So you play off the commonalities, and then you work into the differences, and quite frankly, they're not as great as you might think. I mean, we both have employees who have worked at each other's organizations. They have a common set of values. It's about putting the patient first. It's about being respectful to your coworkers. You start with all that, and quite frankly, we think those will be overcome.
I think cultural integration, you're right on, is going to be key. But we have found commonality not only in mission but also in values.
With the merger, sometimes there's a reduction in the number of employees because of the duplication of services. Some of your employees may be concerned that may be a possibility. Can you offer them any reassurance, or can you give any insight as to any plans for any type of reduction of payroll?
No, we're nowhere near moving into that kind of a discussion, and quite frankly, we think this provides a much more stable employment platform.
Yeah.
I mean, this makes us the largest employer in the region. And quite frankly, that strength, we think, will be reassuring to folks going forward.
Yeah.
Are you seeing any changes in you looked at expanding other facilities, other clinics, your clinics around the area? Does that change any future plans?
I think in terms of us opening up additional facilities, is that I think until we really do our strategic plan, we won't know the answer to that. But I think certainly one of the goals of this that we're looking at is ways that we can enhance access, and so that would probably fit into the future. But right now, until we really sit down and do some strategic thinking, we won't have an answer to that.
From a foundation standpoint, how do those who potentially have donated to either foundation make sure that if this merger potentially does go through, that the money that, let's say, they want it allocated for Rockford Health System then goes towards that cost?
Well, I think in establishing the foundation as an independent foundation, and in looking at their governance structure as well as their bylaws. I think, first of all, we will respect that, we'll honor that, and certainly look forward to working with them as a foundation that's helping, if not a component part of the new organization, the entire organization.
But do you have a separate board that would potentially oversee that versus?
Yes. As an independent board, it would have its own separate governance structure.
Any potential hitch points as far as regulatory agencies are concerned at this time? Does it look like somewhat smooth sailing, a little choppy?
Well, I mean, and as part of this next phase, the extensive due diligence working towards a definitive agreement, we'll be bringing in outside experts that will help us look at those kinds of issues. But as I say, certificate of need would be required at a state level, and then we have the federal review of the situation. Quite frankly, the thing that has changed dramatically in the last decade is the geography where competition is now occurring. So we feel pretty positive about passing or getting over those hurdles.
We do expect to be prepared for significant work with whether it's the Federal Trade Commission or the Illinois Health Facilities Planning Board, or as Dave said, any other aspect of government on that. We think we have a very good case. I'm sorry, the time frame. We signed the letter of intent. We're looking now to do due diligence, and hopefully by the fall, be in a position to sit down and decide one way or the other whether we make a decision on this. Mike?
Are you planning on maintaining both campuses?
Yes.
Let me just advance. If you at least Mike had the gumption to ask the question, because I'm sure it's on everyone's mind. Well, what about that West? We are flourishing as a West Side facility, and when you look at our Winnebago clinic and our Rockford Health Physicians, it's one of our most successful practices. We get a significant number of referrals that come to our institution from that western region all the way to the Iowa border, and so we're absolutely not going to walk away from that. We're going to make a commitment to that campus.
You mentioned regional competition a couple of times. Are you losing a lot of potential customers to other markets in the surrounding area?
I mean, there has been some attrition in the past where people have left the area. I think the goal of this collaboration is to establish programming that will allow them to stay here. This is about strengthening Rockford as a regional destination for healthcare. So yes, there is some migration out of our service area, when in fact we can address many of the needs that people may be leaving for.
The region has seen several other merger and acquisition attempts in the last 25 years. I guess, what makes you guys confident moving forward, or what makes this different moving forward?
Well, I think the model that we have in place is a strong model. I think clearly the timing, and if you look at where we're going, right? This is an industry that hasn't seen significant change since before World War II. Sure, there was Medicare in '66 and DRGs in '84, but come on. And so looking forward, and we're not doing this because of healthcare reform, but if you look at the key principles behind it, the bundling concept, the geographical variability, the accountable care organization impact, the new ways we're going to measure clinical outcomes and clinical excellence. You need to have an organization that is structured, that comfortably meets those challenges and flourishes in that kind of an environment. We feel strongly that the model that we're putting together will do just that.
If the deal is approved, what do you do then with does it include the land along I-90 by Riverside that you can?
That'll be part of our negotiation. That has not been determined. Mike.
If it does happen, is it possible there might be developed more residency programs then, that with the combination, like they have in Peoria?
Well, to your point, we've got an exceptional model in Peoria. In fact, Peoria is the residency center of downstate Illinois. Gary and I have talked about that, and we think there are great opportunities going forward.